So we're going to be talking about innovation, right? So I'm going to set it up with a couple of provocative, I hope, comments. Yesterday, I was at an event where there's an organization called Ashoka that was launching Africa Hub. And one of the things they mentioned about Nigeria, they presented all the data we've seen about the country's potential, the country's purchasing power, the amount of FDI that's coming into the country. But the one metric where Nigeria was supposedly lacking was, interestingly, in innovation. So this is a kind of an interesting topic. So when I started looking up, I did what most people do. I went to Google. I said, please, what is innovation? And so I got a business dictionary definition of innovation, which I'll start with. It says it's the process of translating an idea or invention into a good or service that creates value for which customers will pay. Then the second way to define innovation again is it often results when ideas are applied by a company in order to further. So the first one, you have to create something your customers will buy. Then now you have to further satisfy the needs and expectations of the customers. So first you get the customer, and then you continue to satisfy their needs. So I'll use that as a premise, and I'll start here. I want to give us 3 pillars to frame this discussion, because we've talked about where everything is. Ms. Ezine's panel ended up with 3 takeaways: standardize, scale, and sustainability, right? So I'll give us 3 pillars on which to have this discussion within innovation. One is people. The other one is growth, which is financing and profitability or revenue. Then the third one is a learning culture. So how have you, within your company, how are you using people to innovate, to address customer needs? And I'll have each of you address that. Then we'll talk about the others. Please.
So hi, my name is Ifeoluwa. I'm the head of partnerships and growth at LifeBank. LifeBank is a medical distribution company that helps hospitals discover essential medical products like blood and oxygen, and we deliver it to them on time and in the right condition. So that's what LifeBank does. And as head of partnerships and growth, what I do is find, cultivate, and develop partnerships that drive our core business, that fund special projects or launch new products. So I'm kind of like a Jane of all trades, if you will, in that regard. So in terms of people, we've recognized that we have to invest in our dispatch riders. Our medical dispatch riders are really like the core of. They're the ones that are out in the field delivering stuff to hospitals. And in that recognition, we realize that we can't outsource this. We're moving sensitive products. We can't outsource it. So we have to invest in them, invest in their training, invest in their development, invest in their, branding and composure, so that when they're out in the world, everybody, that, this is LifeBank. They're out to save a life. We're delivering essential medical products. So that's how our investment in people in that regard has happened. And we're a growing company. We're big in name, and we like that people know our name and have recognized the stuff that we're doing. But in terms of money, we're still babies. We haven't raised that much money, but we're on the path. So it means that we also have to invest in nurturing people in terms of staff from the ground up. So we have to invest in training them, because we can't really afford big shots. We don't have, hopefully soon we'll have Ndela money, but we don't have that quite yet. So investment in people and giving them training and nurturing and ensuring that they are progressing along in their careers and continue to add value is an important part of how we've invested in people.
Hello, my name is Desiree Craig, and I work at CC Hub as the head of the product team. CC Hub is actually an innovation center, and our goal essentially is to tackle problems in society. So our investment in people, I'll use 2 examples. So we invest in people externally, and so we do that through the startups that we support. We have our pre-incubation program and our incubation program, where we take startups like LifeBank, they still are in our portfolio, even though they've graduated, and support them through funding, mentorship, and business support. That's how we invest in people externally. Because what we realized essentially is to solve problems at scale, you're going to have to support people across different industries who are empowered and passionate about the problems that they're solving, and then basically provide them with the resources that they need to better solve those problems. Internally, I would also talk about my unit, for instance. So I head the product unit, and what we do essentially is to support the products built by our startups, but then also the internal products that we build. An example of that product was mentioned in the report presented earlier called NIMCure, and I'll probably talk about it a little more later, where essentially we developed a TB management platform in partnership with NIMA, and we're currently piloting, so it's a medical trial, it's a 6-month trial, and we have patients using the application. The goal for us is to learn as much as we can and validate that process so that we can scale the pilot to other countries, but then also other parts of Nigeria.
My company isn't a startup anymore. I think that you've graduated from that. We've been in business for almost 10 years now. I'll say that we're a mature, medium-sized company. We've had to invest in people over the past decade in terms of our doctors, in terms of our engineering teams, in terms of our pilots, so our crew, and in terms of all the partnerships that we have globally. We work with a network of 3,000 hospitals across the world now. We're operational in 11 countries, so it has taken a lot of investment in people to grow from a one-person company, just me, to that sort of scale. But I think what people would be more interested in the room is that I'm also a director in the Green Tree Investment Fund, and we invest in early-stage startups. And in terms of our portfolio, what we're looking for and how we support people, how we support founders. So how we invest in people is we're looking for people that are passionate about problems, but also people that are commercially savvy. So I hear a lot about, we need to raise more money. But hardly anybody talks about how they need to make more money as well. So we're always looking for people that are, very passionate about the problems that they're solving, but also commercially savvy. They understand sort of how to sell, how to market their product, and how to get their product to customers, and understand customer service as well. And we support them through a mentorship program. Obviously, we support them through cash, first of all, but we also support them through mentorship, supporting their programs, in our area of expertise. On our board, we have we have a banker, we have me as a doctor and entrepreneur, we have an expert in marketing and customer service. So we bring our skills to the table and help develop our leaders over to our business leaders, the leaders of our portfolio companies over time, with one-on-one mentorship, of course, and with a more structured mentorship program for the companies that are struggling.
Okay, thank you, ladies. So one of the things we find out is that whenever you do a healthcare conference or a healthcare seminar, you get the standard, parade of data of what is happening in Nigeria. There's the usual maternal mortality. So there's enough problems to address, right? So we're not going to go back and regurgitate where we are. We are where we are. The purpose of this innovation panel is to discuss how. It's not the why are we here? We need healthcare. What are we doing about it? What's the condition on ground? We've addressed it. This is the how. So the second part of what we're going to talk about is what everybody's been alluding to earlier, is growth. So Ola said she's been in business for 10 years. That's interesting and commendable in healthcare in Africa, and a business segment that actually needs quite a bit of capital investment, because managing helicopters and logistics is not easy. The second part is the growth. But first, before we talk about the growth, I would like each of you to decide, because that will set up the third piece. How did you determine where you want to do business? And once you determine where you want to do business, talk about two things. How you got money to get started, so financing, and then how are you making money now? So how did you decide which of these big macro questions to address? How did you get money to get started as a company? And today, how do you make money?
So Life Bank was founded by Temitope Atubosun in 2016, and before Life Bank's inception, she had I don't know if a lot of people know this story, but she worked in development a few years ago, and she was in the northern part of Nigeria and encountered a woman who was essentially dying from postpartum hemorrhage, and that really triggered something in her because she realized that if things were different, she could be that woman. So she had a passion for working to reduce Nigeria's maternal mortality rate. And her first Life Bank zero point 0.5, the before Life Bank, was a nonprofit called 1% Project. So one of the issues with blood supply in Nigeria is not enough people are donating blood, not enough people are voluntarily donating blood. And voluntary blood donors are the bedrock of a safe and abundant blood supply system. So she started the nonprofit 1% Project to encourage voluntary blood donation, to foster a culture of voluntary blood donation. But upon deeper reflection, she realized that, wait, okay, there's supply. For example, in Lagos, there is supply for the most part, but the issue is finding where the supply is. So there's the supply portion of the problem, and there's the insufficient supply portion of the problem, and there's the logistical portion of the problem where there isn't any visibility into what's available, the blood types available, where you can get it. So that's how Life Bank was born. We're solving the discovery and delivery problem of essential medical products. So we started out with blood, and it's not only blood that hospitals have trouble finding. Oxygen is another problem. Vaccine stockouts happen. So that's how Life Bank grew from wanting to solve a particular blood-related problem to wanting to solve essential medical discovery and delivery on a larger scale. So that's how we happened on the problem. What was the other question?
So the discovery, right? The determination of how did CC Hub determine this is what we want to do?
Okay, so last year was actually the first year that we tried this model of building a product as ours and in partnership with another organization. Essentially, before then, the past 7 years or so had been spent supporting startups. But then what we realized essentially, so in the healthcare sector, partnerships are key. And it's important because startups typically don't have the leverage to partner with bigger organizations and offer them value. And so with the NIMCure product, for instance, we were approached by one of the researchers at the Institute of Medical Research because they thought that we would be able to support them towards building the solution. And so it was a eureka moment for us where we realized that the problem essentially isn't necessarily technology and having built something. The problem essentially is having access to the right people who would, one, have domain expertise and be able to share about the problem, but also help with distribution and solving that problem. So this is a model that we're currently piloting, and it seems like there are certain sectors in the country and in the industry where essentially, if you don't have a strong partner, then it's hard for you to access the partners that you need, and your solution essentially doesn't have the potential to scale. So that's how we happened on TB as an industry, so TB and HIV as the current sectors that we're looking into.
Okay. And maybe you can very briefly talk about the genesis of your business.
I think in my second year of medical school, we had a huge family problem. I was in England, and we're trying to move my sister to Abuja. That was all we're trying to do. And we ended up having to start speaking to an air ambulance company in South Africa to move between two cities in Nigeria. And by the time we had made all the organizations, tried to secure it, because she was too sick to go by road. She was on continuous oxygen at the time. My sister actually died at 12 years old. Not because the help she needed wasn't available anywhere, but because she simply found herself in the wrong place at the wrong time. And I realized that there are over 1 billion people across the world that don't die because the help is not available anywhere, but simply because they found themselves in the wrong place at the wrong time. So that was the premise for starting Flying Doctors. And how we make money. I think that a lot of people when looking at the startup space, a lot of people in the general startup space from investing, just for the benefit of people that are in the starting up their own companies, imagine that every company that they start has to solve a problem that they know about. So most girls, for instance, they sell hair, they sell shoes, they sell things that their friends will buy. They're business to consumer businesses. A lot of guys, they sell cars. They sell PMS because those are the things that they're familiar with, and they sell, again, business to consumer. But I think that when I was thinking about it, I was thinking about how to sell something that I would actually make money from, because I wasn't sure whether I'll be able to raise any money from investors. My parents were not that recognizable, and they didn't know anything about business, and they were poor. So I thought that if I go and try and raise money without any network, I've not done an MBA, nobody would give me any money. I have to make a lot of money first. So I started looking at who has a severe, real need for this issue, who needs medical transport in this Nigeria. And it turned out that the oil companies and the military really needed the product. So I said, okay, pay me first, and I'll get it paid afterwards. And they did. So I ended up actually having a customer-funded business model where I didn't raise any money at all. And I made a few $100,000 in my first year. And from there, I've been able to grow it to a multi-million-dollar business without actually raising equity finance. Any of the sort of financial issues that we've had.
That's definitely worth a round of applause, please.
They've been able to solve our issues. Because when you have your cash flow and you know that you're solid financially, then the bank will actually give you money. I show them 5 years of consistent cash flows where customers have been paying me. I have steady customers as big as those companies are. So they've been able to give me money, and the banks have been able to support me. So a few years ago, we started realizing that actually, even though we have big clients, and a lot of these people, I mean, even though the clients are big, the people are very small. So people that get injured in war are not the big people that you see on TV, not the chiefs. They're actually, people on very small salaries. So it has helped change a lot of lives and helped kind of motivate the people that are really fighting our battles for us. Because we're sitting in Lagos, and there are people in Maiduguri, there are people in Yola that are really, really doing the work. And, I think that if not for those people on the front line, maybe we won't be sitting here today. So that's the kind of impact that we've managed to have. But we realized that it was still too expensive, even for a lot of the local insurance companies to afford, and definitely for individuals to afford. And hospitals also complained about the price. So we partnered with ARIC to create a commercial medical cabin. And it goes in the back of any economy class plane, and it's reduced the price from 90%, by 90%. So we now have our air ambulances also in commercial planes. We just take the seats out, so it converts within 10 minutes, and we can transfer people, patients now, for a lot less than it used to cost before. So that's really our mass market product.
Okay, so thank you. Now, what you've noticed, what you've seen her do is, within a couple of minutes, navigate the whole journey from there's a pain point, which is personal. I want to talk about where you failed, right? Because we don't like to fail. But failure is actually very beautiful if you can fail fast. So where did you start and you realize, this is not the right place because you make a mistake? And then how did that mistake inform how you pivoted?
So I don't know, when LifeBank started, we're a technology company, and we're very focused on our technology and having all of these, applications that will make life easier. And because our dream world is you'd go on the LifeBank app, order what you need, we'll deliver it. We don't even have to speak to you. We don't have to, there won't be any calls or whatever. It'll just happen that way. But we're in Nigeria, where tech adoption is slow, where people have data connectivity issues, where people have trust issues, where they even they're like, wait, I need blood. Someone is about to die. I need to talk to someone. So how we evolved, we have technology that powers our work, but we also understand that this is Nigeria, and we also need to be people-centered and adapt to how people use technology, or adapt to how they interact with services. So we have an app that very few people use. But our call center is how people place orders. So that's how we pivoted or like adapted to that unique scenario where in Nigeria hospitals want to call you. So we have a 24/7 call center that's available, every day of the year, even on holidays, even on Christmas Day, we're always available. So that's how we've adjusted to that. We are rolling out our USSD ordering system very soon to kind of ease people, into that technology, using technology instead of phone calls. So that's what I'd say is our...
So you start with a technology platform to address a need, and you realize your enabler, the call center, is actually where it is a core capability that's actually helping you drive your business because it addresses the customer trust gap, right? So
Correct.
again, as an entrepreneur, don't be ashamed. Don't feel so stubborn that you get stuck in one lane. Keep your eyes open and always focus on what the customer is going to pay you for, right? If the call center allows you to get more customers, just like what I said very beautifully, she went to the customer and said, look, this is a need you have. Pay me, I will address your solution. I'll address your problem. It started working, right? So CC Hub, I think you talked about it earlier. You started looking at one product, and then now you're looking at, people that have the tech ability to scale. So could you talk about how you guys evolved, right? Because I want to get everybody comfortable with the fact that just where you start is not where you're going to end up, right?
Okay, so I'll give a little context with regards to TB as a disease. So apparently, Nigeria is the 5th largest country globally when you look at citizens who have TB infections. And the problem with TB isn't that there isn't a cure, but the problem essentially is access to, getting cured. Treatment is free, but what happens is the drugs are very harsh, so they have very harsh side effects. And it's also, treatment is a very lengthy process. So it's a 6-month period, and then patients are required to go down physically to the healthcare center, take their drugs in the presence of a caregiver, and then go back home. So even though treatment is free, but it's very cumbersome, and then tie that to the stigma associated with TB. So essentially, our solution at the beginning was to develop an application that could help patients connect to their caregivers remotely. So from the comfort of your home, you could sit down, record a short video of yourself taking your drug, send that to the caregiver who approves that, and then your dose for the day is logged. So we had an idea, in the beginning, and we had different features that we were going to implement in the application. But over time, it moved from just a video direct observed therapy application to an entire end-to-end TB management system. So for instance, the first point of entry is enrollment. So a patient comes into the healthcare center and they're a TB suspect. They take a test and they're either confirmed as TB positive or TB negative. The reason why we designed that enrollment system is because there was an instance where 2 patients appeared at the healthcare center to get tested. They presented false details. They got tested. They were actually TB positive. But then when the center tried to reach out to them, their details were false. So we built a simple form, just a web form, put that on a tablet. And so right now, the healthcare center uses that to enroll people, and it validates things like their mobile phone, their addresses, right at the point of registration. The second aspect, essentially, and someone mentioned that earlier, which is prevention, because NIMA they're the only medical research center in the country, and they're one of the primary centers for treating TB. So they have a lot of data around TB patients. But the problem with that essentially is because TB spreads really easily, because it's airborne, then preventing is very important, especially when you have people who come from low-income communities and there's lots of overpopulation, so it would spread easily. So essentially taking that data, ensuring that it's accurate, which is why the enrollment process was very important, but then also analyzing that data so that if there are issues where incidences begin to rise in particular locations, you can spot that and be more proactive about providing treatment to those people. Then the third area, which now became, so that was the first area we were focusing on, which is the patient care application, where you connect with your caregiver remotely. So that became the third part of the TB management platform. And then the fourth area was just the admin platform, where essentially someone internally manages all the patients and the caregivers. So you can see that at the beginning, we thought that we were just building a patient application, But then at the end, we had to build an end-to-end system where everything was connected, and all those pillars are important in ensuring that you combat TB effectively. So I think being open to learning, also being able to pivot quickly and get something up and running is very important. So that's basically how we arrived at where we are presently.
Thank you. So again, thank you very much. That's another illustration of how you start with looking at TB, and I'm not going to assume, but I'm sure that same platform you built, not only can you use it for NIMA now to address other diseases, so you're now standardizing research, digitizing, and giving them a platform to scale. On the provider side, most of them were analog, right? They had pen and paper. Now you've given them a tablet. There's nothing that says you can't replicate that across disease conditions to address pediatric, mother and child. You see how that can mushroom, right? So whenever somebody says to me, and I've had this I've been in healthcare 20 years. I'm not a doctor. I'm just a business guy. But every time people say, oh, healthcare in Africa, there's no money, I ask a very simple question. Very simple question. Everybody in Nigeria, what do you guys brag about the most? Oh, we have a lot of people. Right? It's great. 200 million, depending on who's talking about. If each one of them spends $100 a year, is that about as big an industry as you can find? And it's down to execution. We praise Dangote because he sold small bags of sugar and Indomie. Come on, 100 naira every month. Each one of these people, if you have the humility to go to the person that can only spend 1K, this is one of the industries where you can become a serious billionaire. And you are saving lives, you're doing good. So please, have no shame for trying to make money in healthcare, because you'll be doing the right thing. And you'll be enhancing Nigeria and Africa's true resource, which is all of us in here. It's not the oil. It's every one of us being able to live longer than that 55 or 56 years that we talked about. If each one of us adds 10 years to our life expectancy, our GDPs regionally double, our ability to create 10 Andelas double, and so on and so forth, right? So this is Africa's real business, then agriculture, and then the others. So I'm going to say to everybody, because I'm going to steal from what Ezine did earlier, they finished with standardized, scale, and sustainability, right? Those are the three takeaways they had. I have a mantra that I learned when I was at GE and when I worked for a venture fund in Texas years ago. You start by thinking really big, right? So you think big, you start small, and then you scale fast, right? Or you pivot fast. So those are my things that I guide. I don't wait to be perfect. I just go. So ladies, what is one word that you can leave us with which helps everybody in here embrace innovation, embrace learning, embrace getting the right people in and focusing on their money so they can grow? What are some last words for him?
I'd say meet your customers where they're at, then change their behavior.
Excellent. Excellent. If we were in church, we would be repeating that, right? No, seriously. Just let that sink in for a second. Please, let's give that about 10, 15 seconds. Meet your customers where they are, and then change their behavior. Now, Abimbola said that earlier from Advantage Health, right? By the way, she's one of the coolest people I've ever met, because what she's doing is really, really clever. They're going to where the customers are. They're not forcing people into traditional venues, just like Ola did. Meet your customers where they are, and then change their behavior. Please, I will steal that.
You're welcome to it.
So for me, it's one word, and it would be experimentation. We approached this as an experiment, and so we were willing to learn and we were open. I think sometimes we're so set on the idea that we have, or the process that we have, or the solution essentially to the problem, that we keep pushing and pushing, and we do everything, or we try to do everything it takes to just make that solution work. But I think approaching it from a very experimental standpoint where you're testing your hypothesis. So for us, it's a research project. And essentially, that's why we're open to learning and pivoting along the way. To just be more experimental. If one approach doesn't work, change your approach and focus on something else.
Excellent. Thank you. So you got to meet your customers where they are, then you have to change their behavior. But interestingly, you don't know what their behavior is, and you don't even know how the change will be accepted. So you've got to experiment. Try something, pilot it, and then experiment. Hold on.
While doing all this, don't run out of cash.
Amen. Now, there's just no other way to close that, right? All of this is about money. So I want to thank you ladies very much. And please give them a round of applause. Hopefully you found that informative. And my own little last things which I learned as I'll share, which I did a board retreat, and our company is now pivoting from kind of a startup to beginning to grow, is you have to measure what matters. Okay? So cash flow, track it. Number of patients per day, track it. Actually track it. Your revenue collection rate, track it. Your utilization uptime, how long is the equipment running, track that. Your NEPA bill, track it. These are things that will run you go out of business. So measure what matters, track your cash, learn, fail fast, but learn, and then meet your customers where they are, and then change their behavior. All right? I think with all of that, you should be innovators after today. All right? So let's take questions, I think.
So thank you very much. Dr. Nathaniel George. I'm a doctor, inventor, and the co-founder of Visage Health Tech Innovators.
Thank you. Another entrepreneur.
Yeah, my question goes to you, sir. I think one of the problems we're having here in Nigeria is that everybody's trying to be that superstar rather than looking at the value first. So what I'm trying to say is there is value in collaboration. I would like you to shed more light on your work because you said it's a platform. So I want to know what you mean more by that. So just shed more light on what you are doing because collaboration
in terms of collaboration and how our business model works. So thank you very much. As I said, my journey started from, having the arrogance that I thought I could build a cancer hospital. And then the humility of learning that that's not what the market needed. And then the second arrogance was, okay, I can sell diagnostic equipment better than, and then also learning the market isn't ready to buy it. Then now, hopefully, this is where we are, which is I have to go where the people are, just like she said, and I have to give them stuff that they need. They talk about data. There's a research study at Luth, I think it was a 2006 paper by Professor Juluchukwu. After 40 in Nigeria, men die 3 times faster than women. But it's quiet death, right? So there's a lot of stuff I learned. My whole life I've been selling to doctors. I started as a pharmaceutical rep in the US, so I'm very comfortable in a doctor's environment. Another thing I also learned is that doctors will never admit publicly that they're terrible business people. They will never admit that. So you have to very quietly, because they don't do business finance in school. It's not because they're not intelligent, obviously they are. But it's not something they practice actively. There's the rep, somebody like Ola. No, see? It's perfect, like she's supposed to. So what we do is we look at a doctor's practice and find out an area where there's a need and then they have cash or capital requirements. So we provide technology that they normally would go to a bank to go finance, but it will be challenging. But it also requires a technical person to operate it that they don't have. So we take that service away from them small. So we've bought 2 diagnostic centers in VI where we went to clinics, Lakeshore Cancer Center. So if you go to Lakeshore now, the imaging services is owned by Yako. We actually paid for we own the CT, the mammo, and ultrasound. We're operating that. We went to a cardiology clinic on Sakatinobu. We also bought their ultrasound and echo and x-ray and mammo. We're now upgrading, replacing it, and upgrading it. So now we have 2 diagnostic centers. But we have to partner. We partner with doctors and specialists. So when the patient gets screened and they get referred to a specialist, the specialist is obviously very qualified, but now they'll have upgraded tools. And because we have a network, we can negotiate better pricing and pass on the savings to the customer. We also have a network of about 10, after next month it'll be 28 clinics on the mainland where we do the tele-ECG. So we always partner with doctors so that more patients come in and then we can capture the patient and manage the patient journey. So that's how we collaborate.
Thank you so much. I have this burning question. My name is Dr. Noha. I'm a primary care physician. I'm also board certified in geriatrics. I live in the States. I work there. So I also have a healthcare blog, Health for Nigeria. So my question is regarding funding of innovation. You mentioned that there's a deficiency of innovation funding. So I noticed that most of the innovation contests that pertain to Africa are coming from overseas. And so my question is, how can we engage local partners to implement innovation contests in Nigeria to boost, as a way of boosting innovation, as part of their corporate social responsibility?
Attending a Business in Health conference next month, and one of the key questions that they're asking, I mean, Dangote, Jimovia, anybody who's anybody, all of our favorite billionaires are on the board, and they're chairing this Africa Business and Health. And the question that they're trying to answer is exactly what you asked. How can we get businesses to invest more in health? Not necessarily as only CSR, but how can we get them investing in health? And when I was speaking to the organizers, I said that the answer is very, very simple. Dangote has just spent $25 billion on a refinery. Why didn't he spend it in healthcare? Why did he spend it on the refinery? Because he knew that if he spends that 25 billion, then he can get 200 back from oil, from refinery. But he's not sure that if he puts it into healthcare, he's going to get the money back. Businesses have CSR budgets, but the CSR budgets are never going to be enough to fund the level of innovation that needs to happen in the healthcare space. There needs to be a firm business model behind an innovation generally before big funders are going to fund it. At the early stages where investment funds like WeWork, we still want to see some sort of a business model before it is funded. Now, in terms of the very early innovations coming out of high schools, even in America, most of these things don't get funded. And when you look at the size of the economy, I mean, California, I think they've hit 3 trillion now in terms of their economy. There are just 40 million people in California, and they make almost 10 times what Nigeria makes. So even in California, people that invent things don't necessarily, especially if it's very early stage, they find it very difficult to get funding despite the much bigger economy. So I think like the focus of the conversation really needs to be on how can we make business cases for things that have customers, and then you get investors coming in because they know that definitely, like Dangote investing his 25 billion, the money is going to come out somewhere.
Thank you. All right. Maybe I'll have one more person talk a little bit about, and then I have a particular comment.
So I think what I'll add essentially is we need to get more comfortable with the fact that investing is a long-term play, and so even like with the startups that we support, essentially, one, startups are risky, but two, you just have to play for the long term. So I think with health, it's also the same thing, being open and being willing to risk that your investments would give you returns, but essentially being comfortable with the fact that it's a long-term play.
Thank you. So my own view of that is this. There's a certain seduction with everybody wanting to make a new app to do something. Because apps, downloads, you make money. I'm not a techie, even though I'm a scientist by training. Apps are great, but I think the innovation space in Africa, especially in the part of the reason I'm spending pretty much the rest of my professional career based out of Nigeria to serve Africa. It's because the real innovation is how to get to the customer. The real innovation space is in the business model. Yeah. So Advantage Health, what she's done is she's aggregated 930 pharmacies. I don't know if that really hit, if you guys really understand what that means. So if you are coming to Nigeria, if you are a ShopRite, and you want to find pharmacies, you can pay some consultant or you can just talk to her, right? If you're an American company who wants to buy pharmacies in Nigeria, you can just talk to her. If you have a new drug that you are licensing, you can just, do you understand? If you're in primary care, you can either go look at all the old PHCs that Lagos State has just commissioned 65 new PHCs to be upgraded. Why? Just build one room with a consult room next to all of our pharmacies. That's real primary care. So you have to think about what she said. Your innovation and the way you get money is you have to present the financials of how many customers are you touching every day. So innovation, people don't care about all these fancy words. At the end of the day, it's how much money am I going to make? So every day, say, today we touched 1,000 people. Tomorrow we'll touch 5,000. Next week we'll touch 100,000. People can do arithmetic. That's the innovation. And until you know how to multiply that 1K a day to that 1,000 people you touch every day, you haven't done anything. And with all due respect, there's a lot of people in here who went to really big schools and whatever. All these MIT people, they've invented everything we need in our lifetime. No, I'm sorry, I'm just a sales guy. I just want to sell what these smart people have invented. She did not invent a helicopter. I'm telling you. But there are scientists who designed things in the helicopter that would never make the kind of money she's made. She just used the helicopter to move people from one place to another. So learn how to get to the customer quickly. And if you learn how to communicate that in terms of naira per day, you win. That's the race we're running. Is how many Nigerians can you touch every day? How many Africans can you touch every day? Because you're not just a Nigerian, you are in Africa's biggest market.
Sorry, just to say, you don't have to touch that many people. You can have one customer as well. So there's two different ways to this
There you
thing.
go.
Either you're making =1 from $1 million. There are two ways to make $1 million. You can either make ₦1 from 1 million people, $1 from 1 million people, or you can make $1 million from just one customer. So you don't necessarily actually have to touch that many people, but you need a customer. Some people, you don't even know them. I work in a private jet hangar, and I see people coming out of private jets that I don't even recognize. And I try and Google their names just to see who is this. Those people only have one customer, federal governments. And somehow, they have managed to just find their niche inside one place. So sometimes you don't even have to touch that many lives, but touch one meaningful one that is very big.
At the end of the day, what's the equation? Customer plus money equals success, innovation, right? Customer times money. Thank you. See, I told you arithmetic is my problem.
So this second question is really, again, on innovation. I'm very interested in innovation. So I want to know if innovation can be introduced into the school curriculum, university curriculum. And the second thing, really, I'll just say what I've observed. So I live in Philadelphia, and I've had the opportunity to attend some innovation sessions that Temple University, organizes for their students. So as students, they're creating amazing things. And I always think about what we have in Nigeria. And these are very simple sessions to bring together university students and give them the tools to create and innovate. So what are we doing here in Nigeria about these things if we're talking about innovation?
So I think there's a lot of, so we can do a whole day on education, right? Because that's why I started this pillar with people. So depending, and I'll let the ladies also chime in, there's a whole group of guys, Africa Leadership Academy, Africa Leadership University. There's a lot of transformation going on in the education space because the old model doesn't work anymore. As entrepreneurs, as business people, your way to continue that is in the investment in the people, standardizing their formation, standardizing their kind of skill set, right? But there's an entire universe. To me, most people who know me will know that I'm doing healthcare really just because I want to go start schools later. Because to me, the attraction in Africa is to just get people to change their mindset. But there's a whole bunch of things we can talk about on that.
The first guy that actually taught me how to read a balance sheet and let me know that I wasn't managing my finances properly was actually around the same age as me when I started my business. He was about 22, 23, but he had been in business since he was 16, and he was a billionaire. So I was living in my uncle's house. He was living in a house the same size as my uncle. So I was like, guy, how did you manage to start at 16? He said that he had been part of an apprenticeship scheme in the East. And when the thing finished, you're supposed to start your own business. So he had started. He came to Lagos, went to Computer Village, and started. And now he had turned over his first billion at 22. So we do have these things. I think that one of the most innovative incubation systems is not the incubation systems that you see in Lagos. Yep. It's the incubation systems that you actually see in Abia and in Enugu and in Imo states. And there's a TED talk on it. So we've now been validated by white people. There's a TED talk on it actually, which is very, very important. There's an Oyibo guy that gives a TED talk on it, and he calls the Igbo apprenticeship system the biggest incubation system, business incubation system in the world. Because these guys are able to turn up in Lagos with the small entrepreneurship skills that they've been able to build and really start, at least billion naira businesses with that, and they just need the education and skills and the financing to be able to scale up even further beyond Nigeria. But every time I go to his office, I see people from Lome, I see people from Chad, I see people from Mali coming to come and buy his laptops. So obviously he's established some kind of system where he's able to get cash flow, and he's branched out into electronics now, just bought his land in Banana. He's doing okay, and he's the same age as me. And with no education whatsoever, he didn't even go to university. So I think we do have these systems within our traditional education, but we've just not scaled them to the rest of the country.
As a kid in Cameroon, all the people in the market were from Anambra. I'm like, where are these people from? I have a classmate, Ivo. He's actually in Lagos. He was third or fourth in the class. We went to the top school in the country. And every year, Ivo and Clement and Paul, all of them here, they graduated high school, very expensive school fees. And all three of them went to the market. The rest of us took scholarships to Germany, England. I swear, these guys went back to, I'm like, what? These people are stupid. 5 years later, Ivo was calling us. He flew the entire class. 5 years. He flew the entire class to his birthday party. I told my sons, I beg, we have to go to the market. It's very simple. Follow the cash. They know where the customer is. They try things. They do exactly what you pay hundreds of thousands of dollars in business school to do, because when people have lied to us that we're not good enough. What we do here, this is the most amazing country in the world, because you do that already. So please, look inward. Look inward. All right? And I think with that, we're done.
Thank you, guys. Thank you.